What I'm going to do today is talk about out-of-pocket payments in the Australian healthcare system, how they are, where they come from and why we have them. It might surprise you to know that Australia has a very high level of out-of-pocket payments. If you go to a doctor in Canada, for example, there are no out-of-pocket payments at all, the same in England. Why is it? What happened that Australia has such a reliance on out-of-pocket payments that people often can't get to see a doctor because of costs? Australia has a much higher reliance on out-of-pocket payments than other similar OECD countries. So we've got a universal health insurance scheme called Medicare. So if you go to see a doctor, the doctor has to be paid. And what happens in Australia is the doctor can send the bill to Medicare, an organisation called Services Australia. And they can do that through a process called bulk billing. That is, in the olden days, the bills were on a piece of paper and the receptionist gathered all the bills together in bulk, put them in an envelope and posted them off. That doesn't happen today, it's all done electronically. But how does Services Australia, how does Medicare pay the doctor? Well, there's a fee schedule. One element of the fee schedule is for consultations, and if your doctor visit is 15 minutes, there's a thing called a level B consultation, and there's a definition of a level B consultation. It's called item 23, and all of these definitions and so on is in a book called the Medicare Benefits Schedule. And so each item is defined and there's a rebate paid. The government happens to pay 100% of the rebate in the case of general practitioner services. That's all hunky-dory. However, the doctor has total autonomy about whether they will do this bulk billing or whether they will give you the bill. And if they give you the bill, they can decide to charge extra on top of the rebate the government gives you. This is called patient-billed services. If you have patient billing, the doctor decides not to bulk bill you, then there's a significant out-of-pocket. But the good news is almost 90% of GP consultations are bulk billed. That doesn't mean that lots of people don't face patient bills, because even though 90% of services are bulk billed, only 2/3 of Australians who go and see a doctor have all of their services bulk billed. So a lot of them have some bulk billing and some not bulk billing. The doctor might say, oh, I'm a bit uncertain about your illness, and so I need a bit more information. So I'm going to order an X-ray or a pathology test. So this is information the doctor needs, and the doctor has decided this is necessary. You would think that it's not your choice whether I'm going to actually have a pathology test or an X-ray. This is not something I made a choice about, but even so, you may face an out-of-pocket. Less likely in pathology, almost all pathology tests are bulk billed, but certainly for X-rays, for diagnostic imaging, there's a very high level of patient billing and a very high level of out-of-pocket costs. Then, on top of that, the doctor might say, well, you've got a bad back. You should go and see a physio. And there are defined circumstances in Australia where Medicare covers allied health services. It doesn't cover every allied health service like physio or OT or psychologist or whatever, but it does in certain circumstances. Those circumstances are if you have what's called a chronic disease management plan. And so you go and see a physio. And that too can be covered by Medicare, but that too has an out-of-pocket payment. But what happens if they say, oh, the doctor says, oh, you need a prescription? Unlike the situation with medical services where the doctor can charge whatever the doctor wants to charge, with prescriptions, the government has said there are these defined co-payments that you pay for a prescription. And if you're a pensioner or a healthcare card holder, the co-payment's around $6. If you're a person who's not in receipt of a healthcare card, it's about $40 or so. And these all add up. Do you know that about 500,000 Australians miss out on filling a prescription because of cost? Bearing in mind they didn't go to the doctor and say, yeah, what am I going to do today? I'm just going to decide I want to have a prescription. This is a thing that the doctor decided was necessary, so it's not patient choice. The doctor might also say, oh, I think you need to see a specialist. I need the specialist to give me advice about precisely what is wrong in your case. Still more out of pockets. You know, I said that there was 90% of all GP services were bulk billed. The proportion of specialist services bulk billed is way less, almost half, about 50% or so. of specialist services are bulk billed, and they vary dramatically across the different specialties. Many specialists charge 2 or 3 times the schedule fee, and so you have a huge amount of out-of-pockets. Just as you had some diagnostic tests and imaging done by your GP, you might have more done by your specialist. So all of these out-of-pocket payments add up. Doctors can charge what they like. Government mandates that there's going to be out-of-pocket payments for prescriptions. With prescriptions, you might, if you have so much of them during the year, you might hit what's called the safety net, $300 or so prescriptions for pensioners and healthcare card holders, $1,500 or so for non-concession card holders. There's also a safety net for medical payments as well. Does that mean you're doomed if you're going to see a specialist to have an out-of-pocket payment? Well, there's another alternative path that you might follow on this patient journey. You might actually go and see a public hospital outpatient. The doctor might refer you to the public hospital outpatients, in which case there are no out-of-pocket payments whatsoever, but there's a big waiting list. You might say, oh, I don't want to wait 6 months to actually see a specialist in the outpatients. I have to pay and see a private specialist. So there are different ways. And sometimes some public hospitals have said, well, in addition to our public hospital clinics, we're going to have some bulk bill clinics on site as well. So you have bulk billing clinics in hospitals as well. So it all gets very confusing. But the point of the story is this: the patient journey is complex, and all along the way, at every component of the patient journey, there may be out-of-pocket payments. In the case of medical services, the doctor decides whether there's going to be one or not. In the case of allied health, the physio or the OT decides whether you're going to have an out-of-pocket payment or not. In prescriptions, the government decides there will be an out-of-pocket payment unless you've used a lot of prescriptions. And if you're lucky enough to go to public hospital outpatients, I'm sorry, you might have a long wait. Now, the good news is you can shop around. Even if you've got a referral to a specialist which says, I am referring you to Dr. Bloggs, you can take, and that Dr. Bloggs is a cardiologist, for example, you can take that referral to any other cardiologist, not just the one named. You can shop around and try and reduce your out-of-pocket payments. But there are other things that ought to happen as well, and so we ought to be actually doing a whole lot more in policy to try and reduce out-of-pocket payments in Australia. Thank you.